Okay, it's Dr. Buford. We're just getting started on your left shoulder. We had a little bit of trouble getting into the joint just because of the arthritis that you've got, but now we're inside the joint. We've already seen a bunch of what we call joint mice, or loose pieces of cartilage floating around. I'm going to turn on my suction and the shaver, and we'll see if there's any more that come float. There's one right there. See that? So these things can obviously hurt. They act like little rocks or pebbles inside the joint. A lot of times just the shaver will be enough to remove them because we have suction on the shaver and suction on the cannula that you see there. So you can see there we can work on that and make it go away. So that already looks better. And as we start to look in the joint, we're seeing a fair amount of arthritis, more than we were hoping. And we're seeing that this rotator cuff is a little bit frayed also. This is the rotator cuff tendon here. So I'm a little concerned about this biceps anchor. We're going to go ahead and put a stitch in that and do a tenodesis. As we look down towards the bottom of the joint, we can see this labrum is torn. Kind of expected that. And we can see that you've lost some cartilage on the glenoid also. As we look back here. We'll get this back in, push our cannula down like that. And now we'll continue working on the labrum. Just doing a little bit of a release here. All right, we'll show you some more in a little bit. Okay, so here's the cut edge of the hold the camera there. Here's the cut edge of the biceps tendon. We have a good hold on it, and so we'll be able to do our tenodesis in a little bit. We're going to tie it in the subacromial space, but I just wanted to show you that we were able to release that. So between getting the loose cartilage pieces out and this torn biceps, I think that's the main thing we can do for you here inside the joint. Now your rotator cuff, we get a better look at that. It's frayed, which is what we expected. I don't see any full thickness tearing here. But I am going to go ahead and take a minute to put the camera in the front and have a look from the front to the back. Hold the camera here. Okay, so now we're looking from the front to the back. So here's the posterior glenoid. Actually doesn't look quite as bad as the anterior glenoid. We can see the cartilage is a little bit more intact until we get right about here. But we can see where probably those loose pieces of cartilage came from either the humeral head or from the glenoid up in this anterior region, right? Lift up on the arm. Right in here. So just making sure there's nothing else that's about to be loose. There's There's a pretty good shot down the anterior glenoid there showing what's going on. Okay, so we're just getting our final look inside the joint. Again, here's that area. Rotate the humeral head, just like rotate a little bit. Yeah. That's that area in the humeral head that has some thin cartilage on it. Yeah, that's good right there. And then here's the anterior glenoid, anterior labrum. We've smoothed that out as best we can. And then as we look towards the back, we can see the posterior aspect of the cuff. Even though it's a little bit frayed on the undersurface, I don't see any complete tearing. Our cannula just slipped out. There it is there. And the posterior capsule looks fine. So we're going to finish up inside the joint. We're going to get to work up above next. Okay, so we're in the subacromial space. Let me get something like that. We're looking at the work that we've done. This is where we took off some bone. You can see how this is nice and smooth. This is a crochet hook, and it's obviously flat here. And so this anterior acromion rather, is nice and smooth. I'm happy with the way that looks. The rotator cuff on this side looks great. Here's the anterior portion. Those sutures, that's the biceps tenodesis that we did. That looks good. And here we can see the lateral insertion of the cuff, and I don't see any defects in it. We just had that fraying on the articular side, but nothing that needs to be repaired. So I'm happy with the way that looks. We're going to be finishing up here in just a second and getting you back to the recovery room. So good luck to you now. Bye-bye.